Hi, I'm Abigail Kitchens. I'm the staff veterinarian here at HighRoller Whitetails. We're going to go behind the scenes with Jimmy and Jaden and show you how we take care of our breeder bucks. Today we're going to knock down Sunrise so that we can give him a good general health care checkup, take care of his horns for the season, and also take care of his feet. So the first thing after we've darted him and he's sedated, we're going to cover his eyes just to keep him calm and protect his eyes while they're sedated. And the next thing we're going to do is we're going to put an IV in. So we put an IV in. It's a large bore IV, meaning it's a big gauge so that it flows really, really fast, because we want to make sure that we've got as much fluid in him as we can in that short time period that we have him down. And we just use a plain, just general, what we call crystalloid fluid. It's something that your veterinarian carries. It's just a plain fluid bag, just to replace some fluids in him. And the reason we do that is it helps them recover faster. So if they're sedated for any long period of time, they get a little bit dehydrated. They do, when they're sedated, their blood pressure rises a little bit and then it will fall again. So we want to maintain their blood pressure by keeping them well hydrated, and it helps them metabolize the medications. Ketamine is excreted in the urine, and so if we can give them a little bit of fluid, we improve that metabolism. So now we're going to cut his antlers off, and we do that next because if we run into any complications, because of the duration of the sedative and the anesthetic, want to make sure that that's taken care of next. So we're going to cut his antlers, and the key is make sure that they're not bleeding. Depending on the time of year that you're cutting, if you're cutting them early because there's a problem and you need to get those antlers off, they're going to bleed a whole lot more than when you start cutting them later in the season when they start hardening up. But when you cut them early, you want to make sure that you're getting good cauterization, stop the bleeding. You don't want to use heat because you can kill portions of the antlers, but you want to make sure that everything is good tourniquet on everything before you cut to minimize the amount of bleeding. And then we fill the holes of the vessels, usually with toothpicks to help encourage the coagulation, encourage clotting to prevent long-term bleeding. So that's what we're going to do next. Then once that's done, we're going to check his feet and make sure that his feet are nice and healthy. Feet are incredibly, incredibly important, especially as the racks get bigger and bigger and bigger, because they're carrying a lot more weight on that front end. Normally, four-legged animals carry about 60 to 70% of their body weight on their front legs anyways. But when you add these massive racks to these animals, they carry more and more and more weight on those front legs. And if their feet are damaged or having any problems whatsoever, they're not going to be able to carry that rack. They're not going to do well. They're not going to thrive. So you've got to take care of their feet. It's incredibly, incredibly important to have very well-functioning, healthy feet. And when we get these bucks down, it's the prime time to go ahead and doctor these feet so we don't have problems later on in the season, which would require a second anesthetic procedure, a second sedative. We don't want to knock them down more than we have to. So when we do have them down to cut their antlers, it's the prime time to take care of their feet and take care of them now. So we get them healthy going into the season, going into the breeding season. When we have our animals down under anesthesia, most animals are going to get some antibiotic because we want to prevent pneumonia, prevent secondary complications from an anesthetic procedure. In this case, especially when we're cutting antlers, when animals don't have other signs of disease and they're healthy, we use just a general broad spectrum antibiotic like Exceed. It doesn't have a huge broad spectrum to it, but it's great for skin type bacteria. And when you're cutting the antlers and exposing them to like the staph and stuff that are on the skin, that's a great antibiotic for that. Long duration, good small amount of volume, so you can give a nice small amount of volume. It takes care of the skin bugs that you're going to encounter when you're cutting antlers. Another medication that we use is Banamine. In this case, it's a generic flunixin meglumine. It's a generic Banamine, and it's for pain and inflammation. So it's going to help them get up, recover, and feel better. When you cut antlers, especially really early in the season, antlers have a ton of nerves, and they actually have a lot of pain and discomfort. So if you don't take care of a little bit of inflammation, a little bit of pain, when you cut those antlers, that animal is not going to turn around and start eating right after you cut them. It's not going to feel good for a couple days, and so you want to take care of that pain when you have them down. So we do give an anti-inflammatory and a pain medication while they're down. A couple of just general health things that we do, not including antibiotics and anti-inflammatory and pain because of the procedures that we're doing today, but general health, we do deworm our animals regularly. In this case right now we're using Dectomax. predominantly for Homunculus contortus, which is the #1 parasite that you're going to be dealing with in your captive deer. So we are using Dectomax this year. We're going to alternate dewormers depending on the season and depending on the year, but we are using Dectomax. And then we use some vaccines that are customized for our farm based on the bugs that we have cultured for our farm for pneumonia. We use vaccines that are specific for GI diseases, Salmonella, E. coli, Clostridium, that we've cultured here on the farm, a specific vaccine for exactly what the animals are going to be encountering in the pens here in our environment, what diseases we've seen them have. All right, so once we've taken care of him, looked over him, trimmed his hooves, taken care of his antlers, we want to reverse him. And the reason we use a reversal and we don't just let them stay asleep and wake up is we use a combination of ketamine and medetomidine, and it is a compounded medication we get from Precision Pharmacy. And it is a compounded medication. The medetomidine actually has a longer duration of action than xylazine. We don't want to leave them under xylazine either, but medetomidine does, if we just left them, they would sleep a lot longer than they would with the xylazine sedative. So we do give them atipamezole, which reverses the medetomidine component in the ketamine medetomidine. Usually, ketamine is very quickly metabolized, so they will usually wake up very, very quickly. If you just give them ketamine by itself, they would wake up very, very quickly, but you'd have to give them a large amount of ketamine in order for them to be asleep enough for you to do what you needed to do to them. The reason we use the combination of both the ketamine and the medetomidine is we get a very good plane of anesthesia with the combination of the two with a very small amount of medication. So the ketamine, the body has to take care of, and the animal will metabolize the ketamine by itself. So we don't actually reverse the ketamine component. That's why you have to wait a minimum of 20 minutes after you've sedated the animal before you can give the reversal, because if you don't wait that long, the ketamine is still in that animal system. You're not reversing the ketamine, and the animal will still be drunk trying to get up. So you wait that minimum of 20 minutes, and then you can give your atipamezole, your reversal, and that will reverse the medetomidine component, and the animal will start waking up. The reason we really like medetomidine versus like the tilazole and xylazine combination is medetomidine is so much more specific for the certain receptors. We call them alpha-1 and alpha-2 receptors. Xylazine takes care of both alpha-1 and alpha-2 receptors, whereas the medetomidine is very alpha-2 specific. And that alpha-2 is what actually gets you the sedation, gets you a little bit of pain control, and also gets you some muscle relaxation. And because it's so selective, it has fewer side effects. So we really like that specificity of the medetomidine. Also, it's much easier to reverse and much smoother when you reverse it. So the animal will reverse faster and will come out of it and be less sedated long term. So it's a great medication for them to go down quickly and for them to wake up quickly with fewer side effects. And so that's why we are currently using ketamine and medetomidine combination for most of our procedures here on the farm. So when we talk about them recovering from anesthesia and waking up and it's nice and smooth recovery, well, it doesn't always look that nice and that smooth. And if you've ever experienced a person undergoing an anesthetic event, you have to shake them and wake them up and say, hey, how's it going? And they actually understand what's going on. Whereas animals don't understand what's actually happening when they're waking up from anesthesia. And especially an animal like a deer that has a very significant flight response. And so as soon as they have even remotely start to wake up, they want to get up as fast as they can. But their body and their brain aren't quite functioning 100% yet. And so their brain is telling them to run, but their body just can't do it yet because they're still sedated. So many times they'll try to get up, sometimes they'll fall back down. Also, when you cut these big bucks like Sunrise, when you cut off his huge antlers, he's used to carrying all this extra weight on his head, and now all of a sudden he doesn't have that weight. So he goes to pick up this very heavy head, but the heavy head isn't there anymore, and so he'll actually get unbalanced and fall over. And that's very, very common when you are recovering these animals, is for them to get up and stumble, whether they're unbalanced or they're not quite as awake as they thought they were. They want to run away and they can't get their body coordinated enough to stand up and run off. And so sometimes some animals will get really excited and try to get up real fast, and some animals will just lay there for a while and then slowly get up and walk away. It depends on the animal's personality as well, as far as how quickly they're going to wake up and recover and try to get up. So some of my biggest tips for you guys that are trying this for the first time or don't do this as much as we do here at HighRoller is every animal is going to be different. Some of your animals might be more flighty, a little bit less tame, and might require more sedation. You may even have to dart them more than once. Just remember, on the flip side to that, when you dart them more than once and give them more sedation, you're going to need to give them more reversal to get them up and moving quicker. And then you're going to have those animals that require very little drug and will go down really nicely, and they wake up nice and smooth and walk off. The more experience that you have with the medications and with the deer, the better you're going to be long term. So be patient with yourself, be patient with your animals. Don't ever be in a hurry to do anything, especially when you have an animal that you're sedating and anesthetizing for any type of procedure. That's the biggest tip I have, is don't ever be in a hurry. Always have enough time. Get all of your materials and supplies ready well ahead of time, and always have some backup drugs, whether you need emergency drugs to have on hand, whether you need your veterinarian there just in case things go wrong, whether you need extra antibiotics, extra things to treat something that you might find when that animal is down and they're not healthy and you need to treat additional injuries or wounds or disease. So just be prepared ahead of time, be patient, take your time, and at the end of the day, hopefully you have beautiful deer at your farm as well.